First of all, before I start, I just want to thank the Akron Community Foundation for providing this forum for us to provide education to the community. You know, one of the things that we do that's most important is to make sure that everybody's educated about this issue, and more importantly, to understand some things that you can do as normal, everyday citizens that can make a major impact on this problem in your own families and your own communities. You know, we're living in extraordinary times. You know, if you're a Cleveland sports fan, you know that yesterday was pretty special, wasn't it?
Yep.
You had the Cleveland Indians in the World Series, and the Cavs got their ring, and they raised their banner to the ceiling. And, you know, it was nice because it gave us at least 2 days to get over this problem that we have with the Browns. But in all seriousness, we are living in extraordinary times, and one of the things that really makes our life most difficult is this whole notion of opiate problem, the overdoses and the deaths that come about because of this opiate epidemic. And how we got there is really important for us to understand in order for us to kind of move forward, because how we got there really informs how we respond to this issue. And so I'm going to talk a little bit about this, and I'm going to talk about it in the context of this being a perfect storm. In the United States, we've developed this culture that we just need to take a pill to make our pain go away. That we're not going to tolerate pain or seek other alternatives for pain medication. It's so much easier if we just take a pill. And that's happened for a number of reasons. The first reason that's happened is because we've seen for the first time in 1985 that the United States got involved in direct-to-consumer marketing of pharmaceuticals. And we're one of only 2 countries in the whole world that does this. And as a result of that now, we comprise 4.6% of the world's population, and yet we use over 80% of the world's opiates and 99% of the world's hydrocodone. So again, take a pill, it'll go away. And this direct-to-consumer marketing by the pharmaceutical companies resulted in the overall culture that we've developed. How many of you have been asked by your doctor, raise your hand, if you've been told by your doctor, rate your pain on a scale of 1 to 10? And that's promoted by the fact that our physicians have been taught as part of their medical training to make sure that pain is not undertreated. So part of the medical school training now is teaching pain as a 5th vital sign. So we get pulse, we have respiration, we got your blood pressure, and there's one more that I can't remember. And then there's pain. And so we need to make sure that we measure that pain, and if somebody complains about that pain, then we need to make sure that we do something to address it. But unfortunately, part of that culture that we've ingrained in our physicians has also been incorporated into the certification that hospitals have to go through, and the way that the insurance companies reimburse. And so if you're undertreating pain, of course, then people are going to say that they had this unsatisfactory experience with their physician. Physician gets a lower rating. And so it creates this incentive to overprescribe. And that's not every physician, and it's not every person that goes to the physician that gets overprescribed. But largely, that's the culture that we've developed in our communities. So in the 90s, Purdue Pharma introduced the powerful long-acting opiate OxyContin. And part of that came with a very aggressive marketing campaign that said that these opiate medications are not addictive. And that new philosophy of pain management emerged from that. And with that, resulted in a surge in demand. And the United States addiction rate went up at the same time. So there's an overall growth in prescription drug use. And medical schools are teaching physicians that pain is the 5th vital sign. And what we're seeing now is that as the prescribing goes up, we also see a parallel rise in the number of overdoses and deaths. But there's another piece to this whole thing, and that's the the fact that when all these medications are prescribed, not all of them are being used. A lot of them are being diverted into the community. In the 1960s, this is kind of an interesting statistic, more than 80% of opiate abusers got hooked on heroin first. In those days, heroin was less potent, and it was laced with ingredients to make it go further. So it was 5–7% potent. In the 2000s, is that the right way to say that? 75% of opiate users started with prescription pain medication. So there is a direct correlation between those two things. And the heroin today is laced with ingredients designed to make it more potent, not to water it down. And the other thing that's really disturbing about this is that statistics show that most first-time abusers of painkillers obtain them from somebody other than their physician. They get them from family and from friends. And so we have a culture also, and I think many of us have seen, we're at sporting events or somewhere else, somebody says, well, I've got this headache that just won't go away, and somebody says, well, I've got this prescription that I'm sure, you could just take one of these pills and everything would be okay. And so there's a culture of sharing, and then our young people see us doing that, and because it's a prescription medication, of course, it's okay. And so, again, we created this whole culture that it's okay to take a pill and everything will be fine. Nationally, 1 in 5 high school seniors reports misusing prescription medications at least once in their lifetime. In Summit County, we did a survey of our 19,000 middle school and high school youth, and we found out that 15.6% of middle school and high school students have taken a prescription medication that was not prescribed for them. So again, that culture continues to persist. Now, one of the biggest consequences of this, of course, is that we've had this spate of overdoses, and I've talked a little bit about the fact that these are some of the causes for these overdoses. But over the past 3 or 4 years, as this problem with opiates has increased, we've also seen overdoses to be about 3–4 a day treated in our hospitals. And then this year, we saw about 6.2. So it's been creeping up a little bit over time, but generally it's been pretty consistent at about 3 to 4 a day. Then July 5th hit of this year. July 5th is when the carfentanil hit our communities. We knew the fentanyl was already here, but we saw the carfentanil and it hit our community and it hit it hard. Since July 5th of this year, we've seen 12.5 overdoses per day. And every zip code in Summit County has had at least one. And most of them have had at least 10. We've had 1,695 overdoses as of the end of September. In September alone, we experienced 395. And so you think about that. These are people's family members. They're their children, their husbands, their wives. These are people that are in the throes of addiction. These are just the ones that are overdosing. How many more are there that are addicted? And the data that I'm using is only representing those people who hit the Summit County hospitals. There's a lot of people who are receiving overdose treatment from EMS and law enforcement who refuse to be treated at the hospitals. And so we know that's a low number, but it's certainly a disturbing number. Since 2007, unintentional overdoses have been the leading cause of death, surpassing automobile accidents for the first time. From January through June of this year, we had 48 overdoses, and it looked like maybe that trend was starting to reverse a little bit, and maybe we were making some impact because of some of the things we were doing with our opiate task force. And then July 5th hit, and we've averaged about 35 overdoses a day since July. And the overdoses are hitting everybody all through the lifespan. We have people as young as 11 or 12 who've hit our system who've been addicted to opiates. And we've had people as old as 65 and older who've been hit as well. but the sweet spot seems to be the age range of 25 to 34. And if you look at it from the standpoint of male and female, it's pretty much a male-dominated issue, but there's still 40% of the people who are overdosing are female. So again, it's an equal opportunity. It doesn't really, it's not age specific, it's not geographically specific, it's hitting everybody. In 2016, or in 2014, we saw 144 deaths by overdose. Again, think about that. These are people's family members, their brothers and sisters, their mothers, their fathers potentially, displacing kids. In 2015, we saw 60 additional. And in 2016, what we're projecting is about 217. So it's just a little bit over last year. And we really would have probably come in a little bit lower, but if we're looking at 30 overdoses a day or a month between July and the end of this year, we're likely to eclipse what we experienced last year. And so we have other consequences of this drug use as well. We have costs go up in other systems. Children's Services has a lot of out-of-home placement costs that go up. The courts are seeing an increase in their costs. The medical examiner's got to hire additional staff to handle the load that's put on her. The healthcare systems are seeing this more and more in their emergency departments, and it's taking a toll on its staff. The jails are crowded. We have health considerations. You know, here I am, I've got an addiction, and I'm shooting heroin now, and suddenly I've got these diseases that, you know, hepatitis, or I'm at risk of HIV, and there was a huge outbreak of HIV in Indiana because of the fact that people were using dirty needles. And so there's some harm reduction strategies that we're trying to use in order to offset some of the risks that are associated with this. And we see this opiate fatigue, first responders, clinicians, emergency rooms. You know, I talk with some of our treatment providers, and they say, you know, we just discharged them last week from our residential treatment program, and we're reading about them now in the obituary. That's tough. That's tough. There's a lot of investment that we have as a system. There's a lot of investment we have, each of us, as we touch people and we touch their lives and we see some improvement. There's a reason for hope, and sometimes that hope is dashed. But I'm also here to tell you that our treatment does work and people do recover. You know, substance abuse is one of those issues where one of the hallmark symptoms of it is this lack of insight. People don't believe that they need help. And so part of what we see is that people enter our system not necessarily by the fact that they identify that they need services, but oftentimes they come through the criminal justice system. Maybe not necessarily very willingly, but maybe they'll do this just to placate the court. And oftentimes being forced into that treatment and maybe having that black robe effect, if you will, is enough of an incentive for that person to achieve enough clarity and enough education about the impact of this addiction that they'll likely see some change in their situation and see that treatment is something that they want to, something that can work for them. So as an opiate task force, we have tried as much as possible to look at this thing on a number of different ways. We've looked at education, and that's part of what we're doing here tonight. We've looked at how do we impact the healthcare community. So how can we decrease the number of babies born addicted to opiates because their mothers were so far into the throes of addiction that they didn't even give consideration to the fact that this was going to affect their child. How do we educate doctors about safe prescribing practices, and how do we get people to make sure that they understand the need to use the Ohio prescription reporting system, which talks about people who may be seeing multiple doctors to get medications. These are some controls that are built into the system in order to address this. We have a program to work with our legislators so that we can advocate when we see barriers in the community that help us by alleviating those barriers that might help us to achieve something. And certainly we have a huge investment from our legislature because they recognize that this is a problem, because that's what they're hearing from their constituents. And we work with the criminal justice system, and I think one of the things that's been most fruitful in that whole engagement with our criminal justice system, particularly with law enforcement, is that we've got virtually all of our law enforcement agencies in Summit County, just about all of them, carrying Narcan now. So the ADM board is really responsible for making sure that our system works. And we're up here at 30,000 feet and we fund agencies and services, but we're also responsible to make sure that those services work in the most fair and equitable way and making sure that we don't have barriers to treatment. And while I'm not going to talk a lot about our treatments, I'm going to defer that to Janis here as she talks, but I want to make sure that you understand that the ADM board is committed to making sure that there's fair and equitable treatment and that treatment is available to the extent that we're able to make it available. Our system has been overwhelmed because of this huge amount of demand that we've experienced. Not just demand in Summit County, but demand from our surrounding counties, because we do have services here in Summit County, but oftentimes those services are over capacity. So we built in some additional services, and one of the things that I have in my handout are some of the things that we've achieved through our Opiate Task Force, but I'm here to tell you too that the board is trying to augment those existing services, so we're purchasing additional beds from IBH, and those will be online very shortly. We're increasing the capacity of our detox program, and those beds will be available before the end of the year. We're also creating interim housing so that when somebody leaves a detox, they're not going to go back out in a use environment and relapse. We want to make sure that we can keep people who are serious about seeking treatment in a protected environment where they can get some interim services, sort of like waiting for your surgeon to be available. You know, we don't just abandon you. We provide some interim, some comfort care, some education. We want to do things to prepare you for when that service is available for you. And then one of the things that I've heard very often is the fact that we don't always have all the information we need to access the system. And so we're creating a referral service that will have one phone number, and you can call that one phone number, and that person answering the call will know where the next available appointment is for an assessment and for the level of care that's necessary in order to make sure that you get the services that you need based on a preliminary screening. And so these are some augments that we're making to our system, not only to increase the capacity of our programs, but also to make sure that our system works better. And that's based on the impact and the feedback and the input that we've had from the people that we've talked to in the community that have told us how our system feels. I've heard that, and so what we want to try to do is make sure that our system is as, that our system is as responsible as possible. So I'm going to talk a little bit about, I'm going to let Janis talk a little bit about treatment, and she's also going to share a little bit of her own experience.
Good evening. Thank you for having me this evening. Thanks for inviting me, Jerry. So, you know, there's a stigma about addiction. And one thing that the opiate epidemic has, I think, is bringing to light is that that addiction is a disease. And a lot of people, I think, may still not believe that. You know, why doesn't the person just stop using? Why does the person not care about their family or their children? Or why do they care more about drinking or using drugs than they do about anything else? And I would guarantee you that if you asked any addict who admits that they have a problem, they would love to be able to stop using. They would love to be able to be there every night to tuck their child into bed. But the disease is overwhelming. It compels a person to do things that they wouldn't typically do if they're not in active addiction. If you've never experienced that type of overwhelming compulsion that would take you away from your child for days on end, because you know it's unimaginable. On a very smaller scale, think of, you know, a lot of people like sweets. So you might have an urge to go get a cupcake or a cookie. And if you think about it long enough, that urge is going to turn into a craving a lot of times. And you go and you have that cupcake. And then you might want to go and have another one. And you can't just eat one, right? But what happens with drugs or alcohol is that when the addict brain starts thinking about that or uses the first time, that urge or compulsion that you have for that cupcake is exponential. And it just takes over their whole thought process. And that's all that they can think about. It's like a light switch. That was my experience. When I finally crossed over to admitting that I had a problem with drugs was the day that I literally was stone cold sober that whole day, and my son was due to get off the bus any minute. And this light switch went off in my head that I can't explain to you other than that. And it said, you need to go use. And in that moment, I was so compelled to go do it that I called my mother, made up some story so she could come get my son off the bus, and I drove to Akron and got what I needed. The disease of addiction had become my puppet master. And due to that disease, there was a point in time where I didn't see my son for 2 years. I didn't see my family for 2 years. Did I want to go home? Yes. Every time I got a moment of clarity, though, a couple things happened. Number one, I looked at the wreckage of what I had left behind, and it was overwhelming to me. And number two, as soon as I started feeling better, kind of physically, that craving would kick in again. And I would be compelled to use again. And it's a downward spiral that we go through. And we start losing self-esteem and self-worth. And yes, was I one of those people on the street that was homeless? Mm-hmm. I was. I was just like that. I was not raised like that. I was raised in a good home, 2 parents. Dad had a great job. I had a good upbringing. I was raised in the suburbs. But I started drinking at an early age, and drinking led me down that road to other drug use. One of the things that we're able to do now in treatment is, with the opiate epidemic in specific, is that we have to remember that there's a counseling side and there's a medication side. Medication-assisted treatment, Suboxone, methadone, Vivitrol, those are kind of things to get a person through, their withdrawal. Those aren't necessarily meant to be on for the rest of their life. It helps the opiate addict with their cravings. The other piece to that is counseling, because the thing is, addiction isn't about the substance that's being used, okay? I'm going to say that again. Addiction isn't about the drug. It's a thinking disease. Because what can happen is someone can put down alcohol and pick up a drug. Someone can put down opiate and still smoke marijuana. It's all the same disease. A person can pick up behaviors. They can pick up gambling now. Okay, well, I'm not using anymore, but now I'm gambling. Because it's a disease of addiction. And the counseling piece is really important because it helps with coping skills. Because if I'm going through a bad day and I don't want to feel what I'm feeling, as an addict, my first response is, I want to feel better. And I'm going to go to what I know makes me feel better. And I want that dopamine rush. And if I'm not using it anymore, I might go find something else. So the counseling is really important. When someone goes to rehab, I've heard people say, well, send that person to rehab and then they'll be better. Well, that's not the end of the story, because the addict brain is always going to be an addict brain. I'm a person in recovery. I have to stay around people in the recovery community. I have to stay around people who are like me. That's so important. So supportive services are really important. So when somebody gets out of rehab, they've gone to rehab and they get out of rehab, recovery housing, so important. I went through a program. I went through a residential treatment. Then I went to HM Life Community, or HM Life Services for 2 years. That was my housing program. I needed that stability. It's so important. I had a caseworker who visited me every week. I had to go to group every week. I was accountable. But what they did is they undergirded my growth, because my mind from using for so many years had been like stunted, okay, number one. And number two, in the first couple of years of recovery, the person's still coming out of a fog. We do a lot of damage to our bodies and our brains. And it takes a long time for that to heal physically. So the ongoing support is really, really important in this. You know, we hear a lot in the news negative about what's going on. But what we don't hear about a lot are the people who are in recovery, who are successfully, who are out there, who are productive citizens. You know, I don't know if you know people in recovery. Let me ask you this, if you're in recovery and you're willing, would you be willing to be recognized tonight and stand up? Stand up, everybody in recovery. Congratulations.
I'm Eric, I got 13 months.
My name's Josh, I got 19 months.
My name's Kylie, I have 70 days today.
My name's Jason, I got 3 years.
I got 25 years.
You know, I'm gonna venture
My
again.
name is Meredith, and I have about 28 months.
I'm gonna guess that probably all of you know someone who is either an addict or alcoholic, or you know someone in recovery. Okay? This is a rampant disease. You know, Travis, I'm sure, is going to probably talk to you a little bit about stigma, because that's one of the things that Breaking Barriers Hope is Alive talks a lot about. But, you know, it's time to bring this out of the shadows. People should not shame somebody because they're in recovery. You know, I was told early in my career when I got clean and sober, God just opened doors for me, and I was blessed, and I just kept being blessed, and I just tried to keep doing the right thing, and He kept blessing me. But one of the things I was told early on in my work environment was, watch who you share with that you're in recovery, because they'll look at you differently. Okay? And that's a shame. It really is. So what ends up happening is we hear all this negative, but you don't have a lot of people that are willing to come out and say, but recovery is possible, because here I am. Here I stand. You know, that son that I didn't see for 2 years is now a sophomore in college. We have a great relationship. I was 5 months pregnant when I got clean. I was pregnant out on the street. Every day I wanted to stop using, and I couldn't. I couldn't. That's how powerful this disease is. But you know what? Through the services that the ADM provided for me, because I was indigent at the time, through the housing programs, through all the support services in Summit County, and AA, and my church community, and everything undergirding me, my daughter is 10, and she has never had to see me high or drunk, and she doesn't know what it's like for me to not come home at night. You know, and God willing, she never will. So I would just encourage you to continue being active. You know, you're here tonight So I know that you're interested. Just continue to be active in this. Share the light. You know, recovery is possible. And thank you for listening.
Good evening. You guys hear me okay? So, my name is Travis Bornstein. I'd like to thank Jerry and all of you who have the opportunity to put this event on this evening. And I really believe that these are the kind of things that has to happen all throughout our community to tackle the opiate heroin epidemic that we're all being faced with. I'm a pacer, so I don't like standing behind podiums. So some of you have probably heard my story, and if you have, I apologize. You're going to hear it again. And I want to thank Jerry and the folks to give me the opportunity to tell my story and try to use it to make a difference. So let me talk to you a little bit about my son, Tyler. Tyler graduated in 2009 from Lake High School, magna cum laude. His freshman, sophomore, and junior years, he was an all-league and all-county golfer. His senior year, he decided not to play golf and go out for the football team. At the end of the season, Tyler earned the Senior Ironman Award. After high school, Tyler decided to walk on the golf team at Walsh University after not playing golf for over 2 years. And he decided to walk on the golf team. He earned a golf and athletic scholarship and academic scholarship. In 2013, Tyler decided to do a bodybuilding show. And at the age of 22, he was announced runner-up Junior Mr. Ohio. So how does a kid like Tyler get addicted to heroin? So let me try to explain that to you. Tyler broke his right arm 4 times. And he had 2 surgeries on his right elbow. And the first surgery was at age 11, and the second surgery was at age 18. And so at some point in high school, Tyler started abusing opiate pain medicine, which ultimately led him to heroin. And so over the next 6 years, our family watched Tyler in active addiction, in and out of rehab facilities. He accomplished a lot. Like I said, he walked on the golf team when he was in recovery and got a golf and academic scholarship. So ultimately, what ended up happening to Tyler is he went down to Florida into a 6-month treatment program, and he came back home in June of 2014. And on September, he relapsed. And at that time, my health insurance was exhausted. We had 2-time lifetime inpatient treatment. He had exhausted that. Our family was financially exhausted because we had put him in and out of treatment several times. And so Tyler was put on a waiting list to seek treatment and to seek help. And at that time, the waiting list was 3 weeks. So on September 28, 2014, just a little over 2 years ago, Tyler was in the process of overdosing. And the person he was with, instead of calling 911, took my son to a vacant lot on the corner of Arlington and Alfred, and dumped him in the field and left him there to die. And so that's just the true story. And that's what happens in this heroin opiate epidemic. And so what do you do? So what do you do as a family? What do you do as a father? See, I made all the mistakes associated with addiction. See, I was afraid and embarrassed to tell anybody that my son was in active addiction. Yeah. I thought I failed as a father and that my son was a moral failure. Mm-hmm. My closest friends, all my coworkers, no one knew what was going on in my home. Right. It was everything I could do to really just talk about with my wife and my family. And so when I talk, that is the single biggest mistake that I made as a parent, is I just didn't own my story. But what happened was, because Tyler was dumped in a field, it was on the news that night. And then the next morning, it was in the Beacon Journal, it was on the paper. And so from that moment, I've had to just own my story. I could no longer run from it. I could no longer hide from it. It was out. So, what we're trying to do, our family, at the direction of my wife, Shelley, our family has formed a nonprofit organization called Breaking Barriers, Hope is Alive. And so some of the things that we're trying to do is to get this conversation started. See, there's 23 million people in this country that are in recovery, that are active, productive people every single day, but we don't ever talk about it, okay? Right now, the numbers that we're hearing in the state of Ohio is there's over 200,000 people addicted to heroin. 200,000, that's the equivalent to the whole city of Akron.
Yeah.
Okay? They're saying that across the United States, there's over 2 million people addicted to heroin. This epidemic is real. It's in every town. It's in every city. It's in every community. And if you don't think it's in yours, your head is insane. So the question then becomes, what do we do? What do we do as a community? And there's no easy answers in this thing. There's just no easy answers. Okay? Law enforcement, we can't arrest our way out of it. We can't treat our way out of it. You know, we can't educate our way out of it. But we all have to do something. And we all, I believe, we all have an obligation to do something. I mean, Jerry gave you the numbers. 8 people dying every single day. I mean, to me, that's just staggering. That's just staggering. So, in March of 2016, our family formed a nonprofit organization called Breaking Barriers, Hope is Alive. And we're going to try to do all this, we're going to try to help families not make all the mistakes that we made. And really, it wasn't we, it was me. Because my wife identified this thing a lot faster than I did. My wife was doing all the right things, and I failed miserably, you know. So I can't change what I did. I can only change what I do moving forward. So we're going to get out there, we're going to get the conversation started, and we're going to start leading the conversation about what is going on. So we're speaking in high schools. I've been to Springfield High School, I've been to Manchester High School, going to Coventry High School, spoke to Barberton teachers, Norton teachers, and we're just getting the conversation going. Because most people don't understand how innocently this can happen.
Right.
You know, and so when you're out there talking to the students and you say, hey, anybody play sports? Everybody raises their hand. Anybody been hurt? Everybody raises their hand. Okay, anybody give pain medicine? A lot of people raise their hands. And they have no idea what they're taking. And parents have no idea what the doctor has just given to their children.
Yeah.
They don't understand Oxycontin, Percocet, Vicodin, Tramadol are all the same thing as heroin. It's an opiate. I didn't understand that. I didn't know that. And let's just shoot straight here. The doctor would have told me he was going to give my son heroin, right? I'm smart enough to figure it out now. Okay? So those are the things we got to be talking about. Those are the conversations that we got to start having. We got to educate parents, okay? We got to educate students, and we got to bring the awareness to the table. As a community, I really believe that's the only way we're going to solve this problem. This ain't a one-man show.
Right.
This takes everybody in this room and everybody in our community to rise up and say, we want to make a difference. We're going to help. We're going to do what my part is. And if your part is just educating yourself to understand addiction as a disease, that's half the stinking battle, okay? See, I didn't understand addiction as a disease until after my son died. I thought I failed, right? So that's half the stinking battle, that we got to understand it as a disease. And if we understand it as a disease, then I think as a community, we will put the resources behind it. We will stand up and start trying to treat it, and start doing the right thing, and start talking about it. But we can no longer demonize people. We cannot demonize people who are in active addiction. And they do all the wrong things, and they make all the wrong mistakes. Fair enough, okay? But we can't demonize them. So one of the things we often talk about is hope. And I just believe that we have an obligation to also offer hope to what a lot of people think is a hopeless situation. You hear the numbers, they're staggering, okay? I think most of you would agree that I have a lot of reasons to be upset. I have a lot of reasons to be angry. And I'm not going to sit here and lie and tell you that I'm not, because I am. To be honest, I'm really pissed off, to be honest, okay? But with that being said, I also know that if I act in my anger, I'm going to fail my wife. I'm going to fail my two daughters who are 23 and 19 years old, who are looking for their dad to help lead our family. And so what we've decided to do is not act in anger, but to try to act in love and offer hope to what some people think is a hopeless situation. And I believe that if we can accept each other right where we're at, if we can love and encourage and support each other right where we're at, we don't have to change right instantly. Nobody changes instantly, okay? And offer hope, then I think as a community, we really can change this thing. And I personally believe it is the absolutely only way that we're going to change this thing. Okay? So thank you guys very much for giving me the opportunity to talk. Thank you guys very much for giving me the opportunity to tell our story. If there's any way that I can help, I don't know where all you guys live, but in schools and in your community, town hall conversations, whatever, if there's any way that I can help, you know, that's what we're trying to do. My wife has started a support group called The Well to come alongside families who have lost a child, just as a support group to come alongside families. We had our first meeting last week, and just through word of mouth, we were hoping to get 5 or 6 people there. 23 people showed up. 23 people showed up. Okay? I mean, our families are being torn apart. Okay? We got grandparents raising grandchildren. We got aunts and uncles trying to help their families. And we got to do it. We got to do it. It's up to all of us to stand together to make a difference. So thank you very much.
All I can say is wow. Powerful stuff. So thank you so much to Janis, Travis, and Jerry. We want to definitely have an opportunity to open up the discussion to questions. Some of you may have some questions about how we can approach this in the community, or may have some comments. So I'm going to open it up right now to some questions, and we finished a little bit ahead of schedule, so definitely want to do that. Yes, sir.
Yeah, I have a question. I started my group about 3 months ago. We're pretty active in placing people in treatment. I mean, we don't have a lot of options. And one thing that I'm running across more than I should is that people aren't aware of the resources out here. And I was just wondering if maybe ADM and Oriana House would like to market their ambulatory detox and their Vivitrol program a little bit more, because if I'm able to pass on the information and these addicts have been through treatment and everything else and they're not aware of the ambulatory detox, which is a very big tool that they can use, I find that kind of disturbing. And I'm just not understanding why there's not enough marketing on these resources.
Sure. You know, I appreciate that feedback. We have ambulatory detox at Edwin Shaw. We have ambulatory detox at Community Health Center and through Oriana House. If you go to the ADM Board website, and it's admboard.org, you can see what services are offered and by which agency. You can get an assessment through the ADM Crisis Center, and that assessment will essentially determine what level of services are appropriate. Again, what dosage of treatment, and whether ambulatory detox is appropriate or an inpatient detox program might be appropriate. And there's a lot of factors that determine that.
Okay, but just one thing though. Can you make a pamphlet? Because it'd be easier for us to pass them out at maybe, say, meetings and stuff like that. It's better, a person that's in active addiction might not have access to a computer. They might not even own a computer because they've sold a computer to get high. And we would be able to read the pamphlets.
There are resources available that spell out where our services are, and I can make those available.
Okay, can you do that for me? Thank you.
Sure.
I appreciate that.
Any other questions? Yes, Judge?
I'm on the front line of this disease because I deal with it every day at Akron Municipal Court. My question is, because it's such an epidemic that has blown up, the resources, and we are so blessed in this community to have a lot of resources, don't seem to be able to keep up with the demand. What is ADM doing? I mean, I have someone that I referred to ADM board for an assessment. The assessment's scheduled mid-December. So I guess my question is, there's a lot of frustration going on because we can't get people in soon enough to save their lives. What's being done in the community to get the resources necessary to expand programming?
I can't sit down when I answer a question because I was in the Marine Corps and they taught me to stand up when I talk. So I'm sorry. So let me just, you guys heard that I was in the Teamsters Union. So I had the opportunity to tell our story at our national convention. And just to make that real short, in about an hour and 45 minutes, we raised $1.4 million for Breaking Barriers, Hope is Alive. And so one of the things that I've been saying as I get out and talk is to challenge our people in our community. The Teamsters Union has put the first $1 million on the table for treatment, okay? First $1 million, all right? So there's an opportunity for resources. Now, we need other partners. We need other people within our community to step up and say, we're going to also help too, because this epidemic is affecting everybody, okay? And that's the only way we're going to do it. There's a lot of money in this town, as most of you know. We need to get them to put it on the table, and let's do something special in Summit County and make the type of treatment facility there is no waiting list. There is no waiting list. Because obviously at the time of my son's death, he was put on a 3-week waiting list and he died. And people often ask, well, what do you do in the waiting list? Well, you know what you do? You use. That's what you do. And there's a good chance you're going to die. So let me just say, I know for a fact, because I've been with Jerry enough, Jerry's doing everything he can to get all the resources on the table that he can. And to be totally honest, I'm going to push everybody's button in this town to put some money on the table and let's start doing something. Let's quit talking and let's start doing something. And I'm going to lead by example by putting the first $1 million on the table.
Jerry's
I'm
not
sorry.
getting enough resources. My question is, what has been the state of Ohio's history of funding mental health and drug abuse in over the last 5 to 10 years?
Well, there's a new dynamic that's been
I
introduced, and
understand
that's
that, but before that.
that's medication expansion. But prior to that, our budgets have shrunk. The state and federal share has shrunk every year
Yeah, I think
for the
that's-
past 10, 15 years.
Yeah, thank you.
But it's not a fiscal issue. It's really not a fiscal issue. When we have a difficult time increasing capacity because Medicaid pays for the majority of the treatment services, it's really a matter of finding qualified clinicians who want to work in this field, who are qualified to work in this field. Oftentimes, that's one of our biggest issues. We're working with universities right now to try to do some workforce development. We're working with our providers to see what can we do to enhance the reimbursement that they get from insurance companies doesn't carry the costs that make our salaries attractive to people that want to come into our field. So there's a lot of practical issues, and it's not just fiscal. Sometimes it's a matter of finding the right level of workforce. We expand our programs. It takes a long time for us to find people. We had an ambulatory detox program that we started at Community Health Center, and it took us 8 months to find a nurse who's willing to and able to work in this setting. So it's a challenge, and it's something that we're working on every day to try to improve.
I didn't want to skip over Janis. I know you were trying to take the mic. Did you have something you wanted to add on that last
Jerry
question?
just said it.
Okay, perfect. Okay. Yes, ma'am.
I have a question for Jerry. What do you think about, since this is such a deepening epidemic, of posting a listing of all the resources on the front page of the newspaper, ohio.com, every day. I mean, it surely, deserves this kind of exposure. I don't know the, logistics to getting that done, but if it's right in front of you, people are more likely to take advantage of it if they see it every day.
Well, I think it's important to make sure that people know where those resources are. Oftentimes, though, those resources are available. It's sort of like saying, what is everything a hospital offers? Well, a hospital offers a lot of things, but you don't need maternity services unless you're pregnant. And so along the addiction field, there's a lot of things that people would be able to access, but only if they qualify for those based on an assessment and a determination of what dose of treatment that they need. So it's helpful for us to put that information out there, and I think that the ADM board website does as good a job as I know of putting those services out there. So if you go to admboard.org, you click on children, you click on adults, you click on crisis services, all those resources are on there, and that's a place where you read a paper, you throw it away. That's there all the time. So that's my best advice to you.
We have time for one more question. Yes, sir.
It's not really a question. I just wanted to say that I wanted to thank ADM, because ADM is what saved my life, and they got me into Rigel, and they got me the resources I need. And because of all that, I became a recovery coach. And for people that are out there that are struggling before they can get into the place, if they can get to ADM or whatever, and they can refer to Orienta House to a sober coach, because I've been referred to like 3 or 4 people already that I can stay in contact with every day to help stay sober before they get into their place of treatment. So, I mean, that's another kind of a resource that's out there, and I just wanted to make it known that recovery coaches there's a lot of them becoming state certified, and they're doing a lot in the community to help keep people stay sober and keep alive so they can get into the treatment that they need.
And I'd just like to acknowledge that, and that, in Summit County, we have a wonderful way. We're pioneers in the provision of recovery coaching in our communities, and we need to support people who are seeking treatment and make sure that they get the kinds of support from somebody who's walked that same walk. It's no different than people who've gone through cancer surgery, where you'll get somebody who's been through that experience before and can help you navigate. These folks can show people that there's hope. They've been through that. They've dealt with all the things, and certainly their friendship, their ability to help people navigate a sometimes complex system is really something that'll help. And similarly, we need to have that same support for families, because families are often wandering in the wilderness, not really sure what to do. And like Travis said, stigma is still a mighty barrier for families. And so what we can do as a community is really come around and try to support people. And maybe that's the best thing we can do, is while people are waiting for treatment, we need to provide the support to them and maybe some interim services, but we really need to make sure that we take care of people even while they're waiting for treatment.
Again, thank you so much. Let's thank them with a round of applause. And we really appreciate the fact that they brought up kind of that stigma. A few months ago during the summertime, we had an event at the Lock 3, and it was around mental health, and that same discussion came up. It's that stigma where we're afraid to say out loud, here's what's happening to me, or here's what's happening to a family member. So the more that we can get beyond that and have conversations and be transparent and real, the better chance we have of helping solve these community problems. So I'm so appreciative of you guys coming out and sharing your story and sharing, information about the resources that are available. And I actually forgot at the very beginning to say, my name is Teresa LeGrier, and I serve as the Director of Community Investment for the Akron Community Foundation. And on behalf of John Paturas, who is our President and CEO at the foundation, we are just so grateful that we're able to, provide these sorts of opportunities for information to go forth, and hopefully solutions can be sought out and found for some very pressing community issues, and there are plenty of them to go around.